Good afternoon, and thank you for joining us. Today is Tuesday, August 10th, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services with the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director with the Greenfield Health Department, and Dr. Smriti Kari, President of Primary Care with Children's Wisconsin. Thank you all for being here, and Mayor Barrett, I'll hand it over to you today.
Well, thank you very much, Catherine, and good afternoon, everyone. Summerfest made an important announcement earlier today. It announced that all guests attending the festival in September will need to be vaccinated for COVID-19 or test negative for the virus less than 3 days or 72 hours beforehand. Summerfest made this decision based on science, upon looking at our current numbers and disease burden, and out of concern for participant safety and community safety. I commend Summerfest and its leadership in this area and its willingness to do what is in the best interest, not only of its patrons, but of the entire community. The Milwaukee Health Department was consulted with this change and supports the change and offers free community vaccinations at testing locations for concert goers. Walk-in COVID-19 vaccine clinics are open to the public at the Northwest Health Center at 7630 West Mill Road and the Southside Health Center at 1639 South 23rd Street on Mondays and Fridays from 9 a.m. to 3 p.m., Tuesdays and Thursdays from noon to 6 p.m., and Saturdays from 9 a.m. to 1 p.m. Drive-through COVID-19 testing is also available at both locations, as well as American Family Field's Yount, which is the east parking lot, on Monday, Wednesday, Fridays, and Saturdays from 9 a.m. to 3 p.m. More information about COVID-19 vaccinations can be found at milwaukee.gov/COVIDvax. As I do each week, I would like to provide an update on our COVID-19 gating metrics. And as you'll hear more from Dr. Weston, we do not have good news to report this week. We remain in the extreme transmission category for COVID-19 cases per 100,000, up to 240 per 100,000 people. That is not good. Our positivity rate, it remains high in the high transmission rate category, and it's now at 10.9%. Our vaccinations, unfortunately, continue to be somewhat stagnant. 51.3% of city Milwaukee adults, individuals 16 or older, are fully vaccinated, and 56% of adults have received at least one dose. So as I've said in virtually every one of these calls since the vaccinations come out, it is so important for people to get vaccinated. And it's even more important now. The Delta COVID variant has changed the way the pandemic is moving through Milwaukee. With clear evidence of climbing numbers and increased hospitalizations, we all need to change our behavior. Wear a mask and make sure you are vaccinated, and encourage everyone you know to get vaccinated. As students prepare for a safe return to the classroom this school year, the Milwaukee Health Department is working to provide those 12 and older with COVID-19 vaccine. Through its back-to-school health fairs, the health department has administered vaccines to over 100 students, but there are a lot more that need to be vaccinated. The Milwaukee Health Department is also supporting the Sleeves Up for the Kids webinar by the Black Child Development Institute of Milwaukee to encourage vaccinations for students. The webinar will address questions about the safety and effectiveness of the COVID-19 vaccine through a panel of local medical experts, community members, and local leaders. This includes Erica Olivar, Interim Deputy Commissioner of Community Health and Maternal and Child Health Director at the City of Milwaukee Health Department. As an incentive, a $100 gift card will be given to any Milwaukee resident that can show proof that they were vaccinated following the webinar. Register online to attend the webinar series on Thursday, August 12th, from either 11 a.m. to 12:15 p.m. or 5:30 to 6:45 p.m. In addition to these efforts, our community mobilizers continue to go door to door in areas of the city where low vaccination rates are occurring, to talk to individuals through the vaccine process and provide shots for those who want them. As of Saturday, I'm pleased to report that a total of 443 total vaccinations have been administered through this work. And a big thank you to those individuals who are literally walking the streets and knocking on doors. Finally, as part of our nation's COVID-19 response, the American Rescue Plan Act contains a number of provisions to make health insurance plans through healthcare.gov more affordable. And it created a special enrollment period for people to sign up for significant savings in 2021. There are also additional savings for individuals who have received unemployment. The special enrollment period, though, ends on August 15th. There are many insurance navigators and enrollment assisters in the Milwaukee area and who can provide expert help at no cost. So if you're interested, call 211 or go to healthymke.com and look for the insurance saver. And with that, I'll turn it over to Dr. Weston. Thank you, Catherine.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in the county an average of 268 new cases per day and about 2 deaths per day. Now, of note, that's an increase in deaths. It appears that we have seen, as we've seen in the past with waves of cases before, we're now beginning to see the fallout from cases and hospitalizations with an increase in death numbers as well. And we continue to have very concerning national, state, and local trends. So nationally, every state continues to see increases in COVID cases, and every state but one, every state but Rhode Island is seeing increases in COVID hospitalizations as well. And Wisconsin has risen to an unfortunate position, today ranking as the 4th worst for 14-day trends in both cases as well as hospitalizations. Now, over the last month, the state has seen a more than 1,000% increase in cases. That's hard to wrap your head around, but that's more than a 10-fold increase in cases and a 500% increase in hospitalizations. Now, locally, we're actually seeing slightly worse increases in cases and hospitalizations. So the county has seen a 13-fold increase in cases over the month and a 5-fold increase in hospitalizations. So put simply, we're moving in the wrong direction. Now, despite these troubling trends, there are things that you can do as an individual and we can do as a community to both curb this surge as well as prevent future surges. So the first is mitigation, and that's where we must focus to slow the spread, slow the hospitalizations, and unfortunately, as we're now seeing, slow the deaths from this current surge. And mitigation means masking, it means distancing, and it means open air. Now, no one enjoys wearing a mask. I don't, I'm sure that you don't, but we all had hoped just a couple of months ago that we were past that. But this virus had a different course in mind, and we find ourselves back in masks in public indoor settings. It won't be forever, but it must be for now. Distancing and ventilation provided by open air are 2 other critical elements, 2 more layers of protection that must be considered. And when getting together with family or friends, do so outside. When meeting with colleagues, meet outside. When going to a restaurant or a bar, try to sit outside. It makes a significant difference. Now, given the time of year that we're in, and school boards meeting to discuss precautions to take next year, we must also consider mitigation in an environment with the lowest vaccination rates of all, just based on the population of children who can't get the vaccine. And that's our schools. So whereas in the past, a year ago, school boards and superintendents had to cobble together their own unique plans with very little national guidance, that's no longer the case. At the national level, we have guidance from the CDC and the American Academy of Pediatrics. At the regional level, we have guidance from the DPI and the state superintendent. And even right at the local level, we have unified guidance from every single public health officer in Milwaukee County. And every one of these groups, every one of these individuals is in lockstep with their guidance. And at this time, that means universal masking, it means distancing, and it means tracing and quarantine. These are critical elements to maintain health and safety at every level. Now, a key part of that phrase is at this time. This is the current state, but it is not forever. So we talked about mitigation. Next is vaccination, the best way to be proactive about your own health, as well as that of the community. So the newest data from the CDC, we see that the vaccine decreases your risk of infection, symptoms, severe disease, hospitalization, and death, even for those who've had COVID previously. And as we see more and more vaccine requirements from health centers, from government workers, from schools to businesses, and today with Summerfest, we see that the vaccine is not only our path toward improved health as a community, but the path forward to participation in the community. Now is the time to get vaccinated. It's quick, it's easy, and it's completely free. So visit healthymke.com to find a convenient site near you. Thank you very much, and I'll hand it to Officer Roush of Greenfield.
You're on mute, Darren.
That's better, right, Catherine? I'm still new at this Zoom thing after 18 months. Good afternoon, everyone, and thanks, Dr. Weston, for the introduction. Wanted to spend a little time today just to share some of the data from the epidemiological report from last week, looking at those numbers, looking at the graphs. I can certainly tell you about it. I can certainly echo everything that Dr. Weston shared, but sometimes a show and tell is worthwhile. So I certainly want to take a little time to hit some of those key points. As you've heard, we certainly are surging in cases more recently after some very, very low case rates in the months of June and July. So again, throughout the pandemic, we've had our peaks, we've had our valleys with very, very few cases in June and July. And we're now starting this upward trend. And that's been a trend that's been going on for 4 weeks. You heard Dr. Weston mention a 13-fold increase countywide. The way I computed this data based as compared to early July, it's an 18-fold increase amongst adults. And it's a 14-fold increase amongst kids from when we were very, very low. And I will continue to point out, as Dr. Weston mentioned, we're averaging 268 cases a week. And we reflect here at the tail end of this report some preliminary data that will be popping up in this week's report on Thursday afternoon that will surge these rates up even higher. So it's something that we need to continue to watch very carefully. Now, this graph is looking at the entire population of Milwaukee County, and the story is similar and maybe even a little worse in kids. When we look at the sharpness of those increases over the last 4 to 5 weeks, we see it being a little bit sharper among kids 18 years of age and under. And so this has always dispelled the rumor that kids don't get COVID or kids don't transmit COVID, because kids are getting disease. And the story isn't just about COVID cases. I've been hearing way too often that cases aren't dying, so it's not a big deal. Cases aren't needing hospitalizations. But these statements are just plain wrong and represent a blatant disregard for the well-being of others in our community. For the 1 week period from July 28th to August 3rd, the most recent week that we have this data report available, there were 102 hospitalizations in the county. And again, that's a little bit lower number than we experienced at our peak back in November and December of last year, but that's still pretty substantial, and it reflects a pretty substantial increase. Additionally, 10% of these cases, or 10 cases, were hospitalized for kids under the age of 18. So again, that story is changing a little bit too, because previous variants prior to Delta were not hospitalizing kids at such an alarming rate. But it's certainly something that we're seeing consistently, both here in the state of Wisconsin and in other parts of the country. I have flagged for all of you before the transmission rate or the reproductive number, and certainly want to continue to point out that our reproductive number is going in the wrong direction. So on the screen here, we're looking at that transmission rate number, and that rate has been above 1 since mid-June. And certainly that explains a lot of the increase in cases starting in mid-July and going forward here into August. We have seen these numbers continue to climb countywide. And right now that reproductive number is 1.7 for the county, and it's just a little under 1.7 in the city, and it's higher, almost 1.8 in the suburban communities. So that means for every one person who has COVID, 1.7 other individuals are contracting COVID from that initial case. And that's certainly contributing to our increased case rates in Milwaukee County. I know I've been asked before about demographic indicators, and I just want to kind of highlight those for everybody too. There have been times in the COVID pandemic where we've talked about waves of infection. The disease is predominantly in the African American community. The disease is predominantly in the Hispanic community. A third wave was largely in the white suburban population over a year ago. But right now, we see COVID cases occurring equally in males and females. We're seeing COVID cases occur across all social demographic groups in terms of income. We're seeing cases occur in all age groups, except for a little uptick in those 80 plus, but that's the group that's most vaccinated and certainly is showing the smallest increase in recent weeks. And when it comes to race and ethnicity, our three main racial and ethnic groups here in Milwaukee County, that being white, Black or African American, and Hispanic, we are seeing pretty significant jumps. The other population groups tend to be a little bit smaller, so that data shows increases a little bit less easily in the early weeks. So that's something we want to continue to stress, is that anybody is at risk in the county who is unvaccinated. And I want to report that we are working very hard to get a new set of data indicators in our countywide data to look at breakthrough infections, because that's been a key media story that we've been hearing. Breakthrough infections are those infections that occur in those who've been previously vaccinated. And while I don't have a countywide number for you, and it probably won't be available for the next couple weeks, but we're working on it, I can tell you that here in the city of Greenfield, we had 57 new cases in our community last week, Sunday through Saturday. Of those 57 cases, actually more than 70% of those were unvaccinated. So again, I want to continue to echo the fact that recent cases, while there might be a few breakthrough cases, the majority of those cases continue to be cases in those people who are unvaccinated or are under-vaccinated, meaning they have not completed their full vaccination series, either most likely the 2-dose vaccination series. Next, I just want to touch briefly on the testing indicators. This has come up and Dr. Weston mentioned it as well. Testing is up for 5 consecutive weeks here in Milwaukee County, and certainly is consistent with the fact that we're seeing increased cases. We're up to over 20,000 tests per week, and certainly there is more capacity for testing. And I would urge those who have been exposed, who have symptoms, to get tested. We certainly see, as Dr. Weston mentioned, a pretty significant growth in percent positivity, and we're certainly seeing very positive trends that are approaching statistical significance. And then lastly, just on the data front, I'll show you that cases are really readily occurring throughout Milwaukee County. So the areas that are red and orange are certainly areas with higher incidence rates of new disease, and we certainly see a lot of activity throughout the city of Milwaukee in the northern suburbs, but we also see areas of higher activity throughout many of the southern suburban communities as well. So with that, I want to continue to echo what you've heard from other speakers, and likely you'll hear from the speaker after me. The path out of the pandemic continues to include vaccination as a key mitigation strategy. One of those key layers of protection, those layers of Swiss cheese, as I've shared that figure before. Vaccine is effective. Vaccine prevents against Delta, certainly not at the same level as some of the other variants, but certainly, as I told you, over 70% of the cases in Greenfield last week were unvaccinated individuals. Vaccinations readily available, healthymke.com. We know that vaccine is readily available at medical providers, pharmacies, pop-up clinics. I mean, if you're going to State Fair this week, there's even a vaccination booth at State Fair. And any effort, even if it's a few people to dozens or hundreds of people who get vaccinated, is a success because it helps to protect them, their families, and the community. So with that, I urge you all to continue to stay safe, and I will now turn the briefing over to Dr. Kari from Children's Wisconsin.
Thank you so much. So I represent today your pediatric healthcare organization, and over the last 18 months or so, we have certainly spent time working with our public health organizations as well as our school districts, advising on what we know about pediatric health. So you've heard from all the speakers today about the concerns we have around the Delta variant and the increasing numbers for COVID illnesses within our community. This is particularly alarming to those of us who work with children because we are seeing that a significant portion of the people who are getting infected with the COVID-19 Delta variant are unvaccinated. And this increases the disease burden in the community when our kids less than 12 years of age are not eligible for the vaccine yet. And so there's a large proportion of children who are not able to be vaccinated at this time. And we would really love for everybody to consider that layered approach to get our community to be safe so that our children can do things that they should be doing. So we believe strongly that we would love for kids to be back in school in person this year. We saw the stress that it put on our children in terms of their learning capability, as well as their parents and caregivers in terms of managing through having kids at home. And the American Academy of Pediatrics also strongly recommends in-person learning. Ultimately, because there is more than learning that happens in schools, it's a place for children to learn their social skills as well as get their, oftentimes their nutrition met. And so we want to make sure that we are encouraging that. But to be able to do that, we know that we have to have the layered approach. So vaccination, of course, is very important, but masking is also very important. We wear masks in healthcare settings all of the time and have done that successfully for years and years. So not something we love doing, but of course, if there's the ability to protect ourselves, our children's health, as well as the health of the people around you, it's really important to consider masking. So very strongly recommend that. We recommend vaccines for everybody who is eligible for vaccines. More people who are vaccinated, we decrease the disease burden in the community. And of course, other things such as distancing, good hand hygiene, staying home when you're sick, all of those things are going to be really important. The one thing that I would also like to add, that one of the challenges we're facing in the pediatric world right now is we're seeing viruses that we don't typically see in the summertime, such as the respiratory syncytial virus. This is typically one of the viruses we see in the winter and causes kids to be ill. We're seeing a lot of that right now. And so the masks not only protect you against COVID, but also against other viral diseases. And this keeps children healthier in general. The American Academy of Pediatrics has actually put out a pretty strong statement to say that children above 2 years of age can wear masks safely. We have looked to see if there are any concerns around safety for children with wearing masks. We do know that there is some concerns around social interaction because they're not seeing people's facial expressions. But masks are, children are around their own family that don't have masks within the home. So they certainly have the ability to be able to learn how to recognize those facial expressions in other locations. And studies that have been looking at other detrimental impacts of the masks have not proven to be of concern. So masks are safe and they keep our children safe. So it's important that we consider that. The other thing that we have learned over time is that the COVID vaccination can be given with other vaccines as well. So as children are going back to their pediatricians for their well child visits, it's a good time to make sure that they're getting caught up on all vaccines. And so we're preventing all diseases that could be prevented by vaccination. In particular, we do very much recommend the influenza vaccine for both children and their caregivers this year, because it's really important to sort of decrease the disease burden of all possible infections that we can prevent this year, especially as these COVID numbers are going up. So, we have a lot of information on our website at childrenswisconsin.org. Please feel free to reach out to your caregivers if you're looking for more information. But to keep children safe, we want to have that layered approach, which means let's keep them in school, but with masks, with vaccines, and with all of the other mitigation techniques that we did last year that really helped to keep our community of children safe. Thank you.
Thank you, Dr. Curry. We'll now move into the media Q&A portion of our briefing, and we do have several questions coming through in chat. The first two are for Dr. Weston. I'll ask them one at a time. They're from Mike Spalding with WTMJ. The first question is, do you have advice for schools and offices that are bringing people back to in-person learning and work?
Sure. So I think looking at the evidence, there's certain things that we know lead to spread of COVID and certain mitigation measures that can decrease spread of COVID. So simply put, masking, distancing, and open air. Those are the three things to think about for mitigation strategies. And then of course, for long-term mitigation is the vaccine. So whenever you're bringing people close together, you want them masked, especially if they're indoors. You want them distanced as much as possible. And sometimes that means for meetings that can accommodate it, doing telecommunication for those meetings. And as much as possible, you want open air, good ventilation. The best option is outdoors. And so considering those three items, masking, distance, and open air or ventilation, and then also considering vaccination are going to be your best steps moving forward.
And Mike's second question is, with the rise in Delta cases raising interest in tests and vaccines, are there any concerns that supply would run out or become hard to come by?
No, I don't think so. Certainly for vaccine, there's ample supply of vaccine. More than happy to get vaccine to anybody who is looking to get vaccinated. It's quick, easy, it's free. And as far as testing, we haven't seen any slowdown in our test turnaround time as we've increased our number of tests.
Our next question is likely for Dr. Weston or for anyone on the call who has an answer, but it's from Mary Jo Ola with TMJ4. Is the increase in testing due solely to the Delta variant, or do you think travel, businesses, and events requiring proof of a negative test plays a role? Do you anticipate demand to continue to grow?
Yeah, I think there's three reasons why we're seeing an increase in testing. So I think one is simply that more people are sick, more people are having symptoms, more people are concerned about those symptoms. And so they're getting tested. I think the second reason that we're seeing an increase in testing is because of awareness. There's increased awareness, of course, now again, of COVID, of the Delta variant, of close contacts, and that's driving people to get tested. And then the third is, as you mentioned, various testing requirements that may be taking place. So I think all three of those are playing into the increased number of tests that we're seeing.
Our next question is for Dr. Curry, and it comes from Vanessa Swales with the Milwaukee Journal Sentinel. She says, how are pediatric hospitals preparing for a possible influx in cases among young students going back to school come mid-August and early September?
Great question. We're spending a lot of time thinking about that right now. As I'd mentioned earlier, we have seen that surge of the respiratory syncytial virus as well. So we're already entering into this COVID-19 surge with increased number of patients coming through our door. In pediatrics, we do tend to see seasonal variation, and we do have high surge times. And so we've already started to work through that, where we are thinking about our staffing models differently and creating access in our urgent cares and emergency rooms and our primary care offices to be able to handle the patients that are coming through. And we'll continue to evaluate what services we can continue to provide depending on how many patients are walking through the door. So anything that we can do to decrease the numbers would be wonderful for the community.
Thank you. Vanessa's next question, I'm actually going to direct to Director Rausch. Her question is, what is the breakdown of hospitalizations of juveniles versus adults?
Yeah, as I mentioned earlier, that number is 102 total hospitalizations were reported for the time period July 28th to August 3rd. And so 102 total hospitalizations countywide across all age groups. And 10 of those hospitalizations were among kids 18 years or under. So right around 10% of the total hospitalizations reported last week were due or were in kids, I should say.
Our next question is for Mayor Barrett, and it just comes from CBS 58. They're wondering, is there any motivation to require all city employees to be vaccinated or even follow New York City's lead of requiring proof of vaccine to attend restaurants, gyms, etc.?
Well, first, let me say that there have been a number of high-profile employers in the Milwaukee area, including the city of Milwaukee, that are requiring their employees to be vaccinated or submit to weekly testing. I think this is a very good idea. I think it's sound public policy. I have been actively exploring this with my health department and Department of Employee Relations. I think the real issue here comes down to two things at the local level. One is, what would be the sanction if people didn't comply? And second, how do we do that in the context of collective bargaining, and particularly with our public safety employees?
Thank you, Mayor Barrett. The next few questions are from Allison Durr with Milwaukee Journal-Sentinel. The first one is for our health experts on the call. When do you expect to know how many of the hospitalizations deaths in the county are in people who are unvaccinated or undervaccinated, and how will the county calculate this figure?
Yeah, I'll go ahead and take a stab at this, and then Dr. Weston can jump in as well. Both Dr. Weston and I were on a call last week talking with the data folks countywide to really talk about how we capture this number. There are data variables that are asked in the contact tracing and case investigation about immunization status. And contact tracers and public health nurses who are doing the investigation are cross-referencing answers to those questions with the Wisconsin Immunization Registry. So we know the data exists. Really, the struggle has been over the last few weeks getting those variables available to us in our daily data polls from the state. And then now, more recently, it's making sense out of that data and putting those reports together. And unfortunately, it's August and school starting in a few weeks, and there's been a lot of people on vacation the last couple of weeks, but certainly we're working on it, and I hope to have that for you within the next couple of weeks. Anything to add, Dr. Weston?
We're getting the nod.
That's perfect.
All right, our next question is for Mayor Barrett. Would you sign legislation requiring city employees to prove they are fully vaccinated or test negative as a condition of coming to work? Would you sign legislation requiring masks inside when the transmission level in the city is 100 or more cases per 100,000 people?
My answer to the first one is, again, we're actively working to seek that goal right now. So making sure that if legislation were to come to me that accomplished what we wanted to do, I certainly would sign that. Again, we have to make sure that it's workable and know exactly what the sanctions would be for non-compliance. With respect to the masking, I still believe that the most effective way to deal with this is the vaccination. So we're actively pushing vaccinations, but I certainly don't rule that out as these numbers continue to climb. They are very disturbing numbers. Again, we want to put an emphasis on vaccination because we know from all the data that's most effective. I do think wearing the masks is appropriate. And so I have not ruled that out, but right now, again, I'm putting my emphasis on the vaccinations.
Thank you, Mayor. Our next question comes from Bill Miston with Fox 6. He says, in light of the summerfest decision, is there an opinion that the state fair should have had similar protocols in place?
I can jump on this. So I think we are seeing, as I talked about, more schools, more businesses, more entertainment venues like Summerfest, and more governments coming on with the vaccine requirements. And I think moving forward, we'll see more and more of those to keep their events and the community safe.
Chuck Kornbach with WUWM is wondering, how is Summerfest going to enforce its vaccination requirement?
I think that's probably a question for Summerfest. I'm not sure of the answer to that at this point.
And I would assume that they will simply deny entry for people who don't comply with the requirements. That's certainly what I would hope they would do. And I think that is what they will do.
Our next question is from Emily Files with WUWM. She asks, Dr. Weston noted that there is a clear federal guidance on masking in schools this year. What do you make of so many local school boards deciding to make masks optional?
Well, I think we've seen at the national level, the CDC and the AAP The AAP, by the way, the largest and most respected group of pediatricians like Dr. Kari and hundreds and thousands of others come to a unified agreement with the CDC. At the state level, we've seen the DPI, the state superintendent, and then at the local level, Health Officer Rausch and all of his fellow health officers unanimously making guidance. So I think the guidance at this point is evidence-based and clear.
I'm seeing two more chats here. One from Mary Jo Ola with TMJ4. Are there any plans to increase hours or capacity at community testing sites with growing demand?
I would say we'll continue to monitor the demand and ensure that testing is available for everyone who needs testing.
And to answer it from a city of Milwaukee perspective, I have not heard from the health department that they are unable to meet the demand right now. But again, if demand grows, we will, as we have throughout this entire pandemic, we will respond to it.
Allison Durr has a follow-up question, wondering if anyone believes that Summerfest should have been postponed given the increase in cases.
From my perspective, I think people are still looking at the numbers and we have to see what's going to happen over the next several weeks. It remains a very fluid situation, not in the right direction.
And the final question I'm seeing right now comes from Emily Files with WWM. She says, are Milwaukee County Health Departments planning to issue any requirements for schools, or is that not an option because of the recent Wisconsin Supreme Court decision?
Yeah, at this point, there has not been conversation about that. And the reporter is correct. Obviously, the Wisconsin Supreme Court decision certainly changes the landscape and the tenor, and certainly hamstrings a lot of the public health efforts to issue orders. And it would have to be a health officer order to enact a mandate or a requirement for schools. So in the absence of a mandate or a requirement, we have been very active in pushing out media advisories and pushing out information to our schools that are based on scientific evidence, that's evidence-based, as Dr. Weston mentioned moments ago, to enable school districts to make informed decisions. And I certainly know as of this morning, which is the last time I looked at it, it sounded like the Milwaukee Public Schools, the West Allis, West Milwaukee School District, Whitefish Bay Schools, as well as Shorewood School District are making masks mandatory to start the year. And I do believe there's other districts that will be deciding shortly if they haven't decided already.
Excellent. We've got one more question in the chat from Ben Wagner with WISN 12. And perhaps Dr. Weston or Dr. Kari, you can weigh in on this. The American Academy of Pediatrics is asking the FDA to fast track vaccines in kids 5 through 11 years old. Would you support this? And when do you think we could see vaccines in kids younger than 12?
So I'll start off, and I'd love to hear Dr. Kari's thoughts as well. I think for many parents of children 5 to 11, the vaccine can't come fast enough. Now, that said, as far as fast tracking at the FDA, I think we have to be careful what we're talking about. So what we don't want, and what I'm confident the FDA will not do, is skip any of the critical steps in ensuring the vaccine is safe and effective in this population. Now, the options that there are is, for example, if you have a meeting next Thursday for the group to talk about it, maybe you move it forward to next Monday. There's ways to expedite the process without cutting any corners. And I think making it a high priority, FDA has another high priority, which is giving full approval to the vaccine. But along with that, making this a high priority is going to be important. But I think we've seen from the way the FDA has handled the vaccine since it came out that there's no corners that are going to be cut. There's no steps that are going to be skipped, and we'll ensure that we have a safe and effective vaccine before it's authorized for use.
Muted. Well said, Dr. Weston. I completely agree. And if anything, we have heard that the FDA is definitely looking for the right number of kids in the trials to assure the safety, especially after some of the concerns were brought up around the vaccine earlier on. And right now we hear that we potentially might see a vaccine by the end of the summer. September-ish is what we're hearing from our colleagues at the American Academy of Pediatrics right
We have just two follow-up questions here from Brianna Johnson with Milwaukee Urban League. She's asking if there is an increase in COVID cases in schools as schools begin, will there be a transition back to at-home learning? And Mayor Barrett, if you are able to reiterate your answer, if Wisconsin will follow New York City's guidance regarding requiring vaccinations for gyms, restaurants, et cetera.
Well, I can jump on that. Wisconsin obviously has been hampered by the legislature's refusal to do anything in the area of masks. Locally, what we're focusing on right now is we're focusing on vaccinations. That does not mean we have ruled out the possibility of masks. We're looking at those numbers very carefully. We've been talking to the city attorney's office. We've been talking to Dmitry, who is very interested in having the mask mandate come back. So again, it's a very fluid situation, but we are continuing to watch the numbers. But I really don't want us to take the focus off getting people vaccinated. And so we're going to continue to push that, but I am certainly not ruling out having masks come back. Do I think it's a good idea? Absolutely, yes. That people mask when they're out in places where there are a lot of people.
And regarding the school question, Brianna, we might be able to follow up with that offline. I believe that is more of a question specifically for the school districts. So thank you so much for asking that. Those are all of the questions I am seeing in the chat at this time. So thank you all for the great questions, media, for joining us. Thank you to our guest, Dr. Kari. Thank you all, and we'll be here next week.
Thank you all.
Thank you.
Take care.